More than 40 million people in the United States suffer from varicose veins and are more prevalent in women than in men. Your chances of developing them increase if you have a family history of varicose veins. Vascular surgeon Dr. Chris Marrocco at Pomona Valley Hospital Medical Center explains various vein conditions and how they can be treated.
Most symptomatic patients or people that have symptoms from varicose veins have the symptoms in their legs, things like heaviness, aching, burning, itching, as well as being able to see these large veins. The reason that the veins are not working well is the valves blow out, and when one goes out, the valve below it has to take all of the weight of that valve was offloading. So you end up with a continual column of blood basically sitting on the foot. And then this can progress actually to more than just a nuisance. People can get ulcers and ultimately, at the very end of the spectrum, actual amputations from venous disease. But they get very large legs, the weep fluid, get infected frequently, and all of this can be treated relatively easily as long as the deep system is still intact. So there's a deep system and a superficial system. The superficial system is the one that is basically, that manifests as varicose veins. And what that's called is reflux, meaning blood sloshing back and forth across these valves instead of these valves being competent. The superficial system shunts blood into the deep system. And when the perforators or those connections aren't working, those as well can cause problems with varicose veins and with ulceration. So if the deep system is intact, what we do is we treat the superficial system, and now almost all of us treat it endovascularly or minimally invasively with a catheter. There's different techniques, either a laser or radiofrequency ablation. I tend to use radiofrequency ablation. They both have about the same outcomes, but instead of taking the vein and actually removing it or tearing it out, which is called vein stripping, what we do is we treat it with these catheters and basically seal the vein from the inside. It's an outpatient procedure. People go home the same day, legs wrapped. The cosmetic varicose veins are generally spider veins and things that are smaller that require injections. Those are usually not covered by insurance. They're considered cosmetic. The larger veins that could cause social problems, and people are very conscious of those are usually covered by insurance because those are due to incompetent valves.
Dr. Marrocco gives us a patient's story.
Recently I had a 47-year-old woman come into our office who was complaining of varicose veins. She actually had developed ulcers and some spontaneous bleeding from larger veins that were close to the surface of her skin. And we were able to do her surgery on a Thursday, where we went in, ablated the veins above the ulcers, got her connected with wound care. We did it on a Thursday. She only lost one day of work, which was Friday, and was able to go back to work on Monday with wound care and dressing changes, during the week. About a month later, I recently saw her in the office. Her ulcers had healed, she was able to work, she wasn't complaining a lot of the heaviness and everything else, and now we're treating her other leg, which didn't have any ulcers but had similar reflux and complaints.